Hey everyone, this is our next topic, the opioid epidemic. I have two short kind of recorded lectures for this. This one here is going to kind of give you an overview of the opioid epidemic and what's been happening over the last, really 35 or so years. And then there'll be a separate recorded lecture that I have that's kind of looking more directly at COVID-19 and the impact of the COVID-19 pandemic on the opioid epidemic. All right, so let's jump in here and look at some graphs and that kind of stuff. So this is kind of a shot at like the last 20 years or so, looking at the number of overdose deaths increasing quite steadily over the last 20 years. And then that's coupled with the similar increase in drug overdose deaths involving opioids. So opioid overdose account for a significant percentage. Just about half of all drug overdose deaths are related to opioids. Okay, and so we can look at some kind of startling numbers here. So this is a graphic from the CDC and the NIH, looking at the opioid epidemic in 2016. So it kind of gives you how many people die on average per day, which is alarming. So a topic we're going to talk a little bit more about here. 11.5 million people misuse prescription opioids. All right, so that's a different scenario in which many folks think about drug use or drug overdose, but these are folks that are prescribed opioids and are misusing them. Okay. Over 2 million people had an opioid use disorder diagnosed. This leads to folks trying more street drugs. So you can see there that's 170,000 people used heroin for the first time. So in many cases, we have individuals that were prescribed opioids for legitimate medical concern in some cases, become addicted to it, and then once they are not able to get their prescription opioids, then turn to street drugs like heroin. All right, so all of this has a large impact on the country. Obviously, there's a high death rate like I was just showing, and then when you see these kind of studies as well, they'll measure the impact in terms of economic terms and how this impacts our country. If you're more of an economic-minded individual, that's another way to think of things in terms of burden. Let me slide this over here. All right, so we got two things to look at here. So the table on the right is looking at the number and rate of opioid prescriptions dispensed in the U.S. from 2006 to 17. So I'm going to sit there for a second. So as we look in there, we can say on average it's about 225, 230 million prescriptions for opioids over this time period. All right, so we'll hang out there for a little bit. And again, realizing that these drugs didn't exist, in the 1970s, early 80s, right? So the proliferation of prescriptions for this type of medication just skyrockets. The diagram on the other side of the screen there with Michigan kind of highlighted shows prescribing rates by county. And some of this data, this is all, again, CDC data, which is really the best source for this information, that breaks down at the county level. I think it's really stark to look at it in this way. And what we can see is that this is a problem that in Michigan is more prevalent in some of our rural areas. All right, so rural northern Michigan, a lot of counties that are less populated have high rates. So it's a rate per 100 person. So it takes into account that there's a low population in these counties, have a high rate of overprescribed opioids, and thus that contributes to opioid use disorders and addiction. All right, so again, back to this idea, right? So this epidemic is going to involve prescriptions, right? So physicians prescribing opioids that leads to then an opioid use disorder. So many Americans suffer from chronic pain, right? And these opioids came about as a solution to this problem. So in this case, it was a solution to a problem that ended up causing a much, much, much bigger problem. So how did we get here? So there's a combination of factors. There was a recognition that pain medication that were available in the 60s, 70s, up to the 80s were insufficient. And a lot of research was done trying to find better pain medications. And so some of this was driven by, well-intended folks that were looking to help folks with chronic pain. All right. A counter argument there is a healthcare mindset versus like a wellness mindset. So providing solutions for folks that have pain instead of promoting health and wellness to prevent pain in the first place. And so we started seeing that shift exacerbated in the 80s and 90s. And then a big one is in the 90s, the American Pain Foundation got this idea to add pain as a vital sign. And you'll still see this in hospitals, and maybe some of you have experienced this either through shadowing or working or being a patient yourself, of they will chart your pain daily. Right? That was a new thing. So there's a table of vital signs, heart rate, temperature, blood pressure, etc. Right? And pain was added to that list. Right? So there was this pressure on hospitals to manage individuals' pain. And a key way to do that was then to provide opioids. And so there are several villains in this story, but a big villain here is Purdue Pharma. Purdue Pharma is the manufacturer, was the manufacturer of OxyContin. When they launched OxyContin in the early 90s, they went on a extremely aggressive marketing plan to physicians, promoting it as a safe alternative to morphine, and that it was non-addictive. So they actually kind of hid some of their science about it being addictive and pushed it on physicians, saying, your patients are in pain. This is a fantastic alternative to morphine. And then they started paying physicians as well. There's going to be I put a link on there just for a side note. There's a link on the Moodle site about an HBO documentary coming out next month. If y'all have HBO or HBO Max or whatever, check that out. It's going to have some good stuff on this kind of portion of the story. But anyway, so in short, their work kind of seeded the epidemic. They started this whole thing, and were found guilty. There were thousands of lawsuits. And as of last year, they reached a settlement worth $8.3 billion. And they admitted that they knowingly and intentionally conspired and agreed with others to aid and abet doctors dispensing medication without a legitimate medical purpose. So here's a company that's making a highly addictive drug that commits a scheme to get physicians to prescribe their drug more, knowing that once the patients were taking their drug, they likely would have a hard time stopping it. All right, and this is where it gets into, and you can find a number of stories out there, and perhaps you have family stories to go with this as well, where folks that went in for a knee surgery, a back problem, somebody's playing sports in high school and is prescribed this after their procedure, and they have a hard time getting off of it. They have a hard time getting off the addiction to this drug, and it really starts a spiral of further drug use due to the addiction. This graph here shows the rise in opioid overdose deaths, and specifically which type of opioid was responsible. And so in the 90s, again, this Purdue Pharma episode kind of seeds this epidemic and this big push with OxyContin. And so we have many, many Americans addicted to OxyContin and dying of opioid overdoses. as that started to get cut back and folks started realizing this in the mid 2000s there, it was harder to get those prescriptions and folks were forced to turn to heroin. And so we see this huge spike in heroin overdose deaths from 2010 onward. And now we have this new wave. The new wave is synthetic opioids like fentanyl that are going to be either prescribed in some cases, or there's this huge proliferation of illicitly manufactured. So companies that are making this and distributing it as more of a street drug, in contrast to the prescriptions. But so make sure we see it in waves, right? The first wave that starts this whole epidemic is prescription drugs prescribed by physicians that then gets folks addicted and gives kind of this big rise to now a more street drug scene with heroin and synthetic fentanyl. So quickly here, opioids are good, right? They are a good pain reliever. They can be pleasurable and calming. However, with high doses, the big issue becomes paralysis, right? So with high dose of the opioids, you can get paralysis and loss of respiration, and that's what we see with these overdoses. This is just a list. You can pause it there and look at the list, but ones you've heard of: Oxycontin, Percocets, morphines, methadone, a whole host of others, right? All fall in this class of prescribed opioids. So quickly now on treatment, right? So treatment to solve this addiction problem comes from a combination approach, right? This medication-assisted therapy. So you have methadone or others that are synthetic opioids that are taken at lower doses and are kind of stepped down over time, in combination with, and this is really important, in combination with counseling and behavioral therapies. These have been proven mechanisms to help folks overcome opioid use disorders. Right? So not quitting cold turkey, any of that kind of old stuff, right? This is a proven method to solve this crisis. The one perhaps you've heard of more frequently is Narcan or naloxone. This is an opioid antagonist. This is the fast-acting rescue drug for folks that are undergoing an overdose. So it's either injectable or the nasal spray, as you see there in the picture. And it blocks the effect of the opioid extremely fast. Though I've had, when we do this class live in the past, I've had students that have worked as EMTs that have administered this, have remarked about how fast this really acts and how it is this kind of miracle savior, this antagonist. Importantly, in Michigan, this varies from state to state. In Michigan, pharmacists can distribute Narcan without prescription or intended patient. So there's like a standing prescription at the state level that allows pharmacists to give this. So if you go to the pharmacy and ask for it, they will give it to you. And it's covered by insurance plans in most cases as well, without you having to say who it's for even. So if you're worried about a loved one that has an opioid use disorder, you can get Narcan in case they might ever need it. All right, so the last thing we're going to leave us with here, and this is a big topic that we're doing extremely short, is just kind of changing provider behavior, right? A lot of this started with physicians and overprescribing opioids, and that's still going to be a large factor in how this ends. And so there are a number of studies out there. That this is one from a surgery journal talking about changing surgeons' behavior in prescribing less opioids, a shorter course of opioids, or finding alternatives to them altogether, so that it lowers the chance that patient develops an opioid use disorder, and thus lowers the chance of that individual dying from an overdose. All right, so there's one more lecture on this topic, dealing with COVID and how COVID has exacerbated this problem. And I posted a bunch of resources on the Moodle site as well for you to check out and reflect upon.